I'm Dr. Timothy Johnston with Norge Dental Center. Thanks for giving us a call and scheduling an appointment. We've sent this video to you so that you could kind of get a feel for where you're coming and what's going to happen. I think one of the worst things about going to a new doctor or a dentist is the fear of the unknown. So hopefully this little introductory video kind of gets you acclimated to where you're coming and put you at ease just a little bit. Because after all, plenty of people are afraid of the dentist already, and we don't need to add to that. First of all, we hope we've made a good impression on you already. My receptionists that answer the phones and help to schedule appointments and all that, they're all very good at their job. They were handpicked, and I think they're a talented bunch of ladies who can really put you at ease right over the telephone. And hopefully they got you the appointment you were looking for and got everything cleared up before that first phone call was over. If you haven't been directed to our website yet, please do go there. It's norgedental.com. On the website, you can find our intake forms. Please go ahead and print those off or do it online. There's multiple ways to handle that so that when you come in, you're not sitting there filling out forms while you're going to be seen. Easier to do it at home, certainly in the comfort of your own living room or kitchen table. But if you do need some help with anything, by all means, we're happy to help you when you come in. If you're going to do that, come in a little bit early so that we can help you with it. One of the things that will happen on your very first appointment with us is that we'll sit down and talk, whether I'm your dentist or one of the other doctors there, we have several. We'll sit down with you before the appointment even starts and kind of get to know you a little bit. I don't need to know everything about you, but I want to know about your dental history. A lot of people have all kinds of crazy stories to tell me about what's happened in their dental past. And that helps me to focus on what your hot buttons are and make sure that we're in tune with what's going on in your mouth and where you've been psychologically, sort of, as far as dental appointments have gone. So if you have main concerns, something you want me to know, that's the time. You're going to help to share that with us, with me or your doctor, so that we're treating you in the way that you want to be treated. So you can expect that to happen before we even get back in a dental chair. You'll also meet the front desk coordinator that took your phone call, and you'll meet your hygienist that's going to be taking care of you as well. And that's something to call out as well. Norge Dental Center is a big place. I understand that. We have a lot of patients, we have a lot of staff members. But one of the hallmarks of our business is that we work in small teams. So if you were to come into the office and I'm your dentist, you would meet my coordinator from the front desk, you would meet your new hygienist, and me, and one or two of my dental assistants, and that's it. Every time you come in after that, for the next umpteen years, you're going to meet the same people. I have a long track record with long-term staff members, so they've been with me forever, and patients appreciate that. But more importantly, it's not like you're going to see just whatever dentist is available or just whatever hygienist. We have a small team in a big office, and that's where you'll be. That's who you'll be seeing. So I hope that puts some comfort in it as well. Let's talk about the exam just for a quick second. Not trying to waste your time, but know that we are a very thorough dental office. We're going to check for everything from cavities to gum disease to oral cancer. We want to know everything that's going on in your mouth. That's our job. Between your lips and your tonsils is our job. And let's face it, your physician doesn't even get involved in any of it. So somebody's got to be looking at that, and that's us. So we pride ourselves on the thoroughness. That also means your first appointment for the exam and cleaning and all is going to be about an hour and a half. And I'm sure that the receptionist you spoke to on the phone also let you know for that time frame. It's not always an hour and a half, but your first visit is, because we have a lot of charting and documentation to do. Again, just to make sure that we're doing our best job, that you're getting a thorough evaluation. And that's what you're there for, is for us to be thorough. Another thing I want to share with you about Norge Dental Center, perhaps what sets it apart, besides listening and really getting to know you, is we also are very careful with our words. Some people have dental needs. Some people have dental wants. You might want whiter teeth or want straighter teeth or whatever, but those aren't dental needs. And I'm very careful, everyone in the practice, we're very careful not to confuse the two. I want you to know what's going on in your mouth that could cause you pain or distress or some social embarrassment if a front tooth broke or something, so that you know what your needs are, and we like to fix those. And then if there are dental wants, I want to work on those as well, but that's going to come from you to us. We're not going to suggest things that are cosmetic. I want you to let us know. So if you do have some things you want to talk about that are dental wants, by all means, that first conversation is the time to bring it up, and we're happy to put that as part of your treatment plan. But again, we're not pushing that sort of thing. At the end of the day, we always remember that you have choices. You had a choice in who you called for your dentist, and we want to try to maintain that relationship and make you proud of the decision you made, make you happy with the decision you made to choose Norge Dental. But also you have choices when it comes to what's happening in your mouth. You may have a tooth that really needs to be worked on, but if you're not going to, You're not going to. No one's going to yell at you. You're not going to get a lecture from us. At the end of the day, it's your mouth and you get to decide on what happens within it. I will give you guidance as to what the proper course of action would be. But again, at the end of the day, it's your mouth. We let you have total control over it. We also, one last thing, we also have a clear sense of the idea that dentistry is not cheap. I know that. Dentistry is expensive, and over half of our patients don't have any dental insurance at all. So we are always very cognizant of that. We try to list out things that need to be done in sort of an order of priority. So the things that are really pretty important to get done, high needs, we'll put at the top of the list. Things are going to wait a little while further down, and dental wants can go at the bottom because that's not a necessary item. At that point, we want to pay very close attention to your schedule and your budget. Everybody has a schedule they have to keep, and everybody has a budget they must mind. So we want you to know that we're not going to force it all on you at once. Again, it's your mouth, not ours. And we're going to let you be in charge of how fast or how slow we go in terms of your schedule and your budget. I hope that when you come in, you get a chance to chat. Even if I'm not your dentist, hunt me down and say hi, Tim. I'd like to meet all the patients that are there. But we look forward to seeing you. Thanks for watching my little video. If you have any questions before the appointment, please give us a call. Otherwise, we'll see you then. Thanks for watching.